Good afternoon. Welcome to the Special Superintendent's Webcast on June 2nd, 2020. Welcome to our superintendents, other district officials. We also have our K groups that represent superintendents and school districts with us, and all the other individuals that have been joining us through the diocese schools, as well as one representative from the Kentucky Non-Public School Commission. Thank you all for joining us as we all work to try to prepare to reopen schools for next year. We have a very packed agenda today. We're going to kick it off with Commissioner Tackett from KHSAA, and we'll have some questions. If you have questions for him, try to get those in now instead of waiting to the end, because he may have to jump off for some other calls. And then I would also point out we are going to try to hit the COVID-19 updates with the Department of Public Health, which I know everyone is waiting for, at 3 o'clock. They could only join us at 3, and so we may jump around in the agenda a little bit just so we're using all these agenda items to fill time until we get to public health. So if we jump around, you'll know why. Without any further delay, Commissioner Tackett, turn it over to you.
Thanks, Kevin, and thanks to all of you all for the great job you've done communicating with us and us communicating back and then communicating with each other. Last Thursday, our Board of Control met in a special session, and one of the many topics they had to try to talk about was what we're going to do with athletics and organized activity as we start the summer. Obviously, the tone and tenor of a lot of the discussion has changed over the last few weeks. From a very restrictive standpoint, we began to see some thoughts of opportunities as we worked with the governor's office, but more particularly because the pressure points with other states opening up, it was a matter that we needed to address. Everything was closed till May 31st, and then beginning June 1, there's now a period where, at least according to our rules, and that's the most important thing for me to preface all this with, according to our rules, for the next 14 days, from June 1st through 14th, coaches were allowed to be with their athletes. And that has not been the case since March, when everything was shut down. There is a huge local jurisdiction element to this. Everything that is allowed in any of the 3 time periods I'm going to briefly describe is allowed by consent of the superintendent through the local board, and that may vary how you operate every day. It may be that you as superintendent have the authority, your board's given you the authority during this crisis to unilaterally act, and it may be that you have to convene a group. That's really a local district decision. But again, anything that we have done that appears permissive is only with your permission. We know of some districts that originally, based on the early on advice of the governor, had shut down their campuses for any activity through the end of June. That may be what you want to stick with. Or you may want to have this opening that's being offered now. Too much research is going on about psychological damage. We've got conclusions that are being reached in a lot of states. The relationship lost of kids with teachers, with coaches, with administrators. So we wanted this first little opportunity of 2 weeks to kind of get them back together. Now, there's a piece of that that's important for you to know. There's also, because of the CDC guidance and even the governor's office guidance, there's some supplies that may need to be ordered. You may need this 2 weeks to be sure that if you're going to allow some things to happen, that you're properly prepared. You're not going to find, as with many of these things you all have dealt with over the last 2 to 3 months, you're not going to find a lot of concrete answers. You're going to find a lot of you shoulds, a lot of you should consider. But every situation is a little bit different. And unfortunately, we're used to operating from a standpoint of everybody being identical. Well, what we're finding is everyone being treated similarly may not result in everyone being identical, because your local health department, your local people may feel differently than the next district. And that's something that's kind of out of character for people in athletics who try to keep everything exactly the same. But it's something that you're having to deal with your schedule, with your curriculum, with your calendar, and with everything else. So we know that everyone is looking forward to having a little more control than maybe we've had the last little while. But just a few key points. Local jurisdiction, it does require your permission. Want to be sure that you understand that relationships matter. And by that, we also have in there, we know that a number of your facilities are not just used for high school activities. They might be used for middle school. They might be used for the local recreation leagues, or the local little league may also use your high school facilities. You've got to manage those relationships all year long, and you may have to make some decisions to allow for use, not allow for use because of those relationships, and that is understood. So June 1st to 14th is that window where we're just meeting with them. It also gives you time to consult with your local health department, the most critical thing you can do. I know that when I sat in on these meetings that Kevin asked me to kind of listen in when you were going through some of your decisions about graduation ceremony. And we know that that was hard discussions. And in some cases, your health department didn't want to answer those questions. If that's the case, default to the governor's public health department, and you will definitely get answers. What can go on at different facilities is contained in the governor's order. We simply kind of explained or expounded a little bit on those, but our board as a state actor knows that they cannot act in contradiction to the governor's orders. So even if we don't like the fact that someone put down that you needed to put paint on a baseball field to mark certain things or to do things that probably aren't very realistic, we don't have the authority to contradict them because of the way we're set up in statute. Now, I've mentioned 3 time windows. June 1st to 14th, no activity. June 15th through 28th, there's an allowance for getting actual sports skills developed in the low contact sports. And I'm going to explain where these links are. You were all sent the document last Friday, but I know you're getting flooded with documents, so I'll reiterate where you can find that. 1st through 14th, just discussion. 15th through 28th, we can get into conditioning. And that means they may be running around the track trying to get in shape. It may actually be an adult taking a look at a kid and seeing if he's really ready for competition or she's really ready when that comes up later on. June 29th in the low touch sports starts a time there can actually be some competitions, and that's baseball is one of those. Swimming and diving was one of those. They're listed all in the governor's order. That does not include basketball or football. The other key thing to remember, and this is, everybody says things and sometimes wishes they'd said them differently. When the governor's office first announced that they were going to open gyms on June 1st, a number of our basketball coaches quit listening. They got excited about June 1st. Right now, there is no legally operating open gymnasium in Kentucky, period. Nobody's allowed to be having basketball right now under the governor's previous order. We have asked for some clarification about when they see that changing. But right now, I can tell you what I was told, there's no intention of it changing before the 28th. Now, that means they could change it on June 3rd. But right now, there's no intention of it changing early because the problems that are created by airflow in a gymnasium. So it's important that they keep everything allowed outside right now. So that's really big. We have asked even as late as this afternoon for further clarification from the governor's staff. We got a sneak peek of the governor's youth sport release about 2 hours before it was released. And we're given about 30 minutes to look at it and see if there were obvious errors. So we haven't really dove in and nitpicked. And part of the reason is that they said they're going to announce it. It doesn't go into effect till the 15th. We got time to make things right if they've got an error. They're really trying to do what's safest for kids. And we're trying to strike that balance between the safety of people getting together and the need for people to get together psychologically. So it is a tough balance. Social distancing is a big part of the governor's order. You saw in the PowerPoint that was distributed earlier by Kevin. I would really encourage you to look. The first link is the board document that they put out last week and authorized it to be put out on Thursday, and our office put it out Friday. Then you've got the information from the governor's order. There's a link there to the governor's youth sports order, and that is extremely detailed. And then lastly, there's the CDC guidance, And I'm a little cautious about even mentioning that because some of their guidance, as you know, continues to change. And I would encourage your athletic representatives to make sure they're keeping up with what the most recent guidance is. Obviously, when we get something new, we will forward it to our principals, ADs, and superintendents. What we're finding is even Friday's announcement that we sent out has not been forwarded to coaches. So superintendents, if you would take this first piece of advice, it might be to make sure that is sent to every coach in every one of your high schools and middle schools. Now, let me answer one last question, and then I'll see if Kevin and Tony or anybody else has a question they'd like me to answer or try to get you more information if I can't answer it. The third period is June 29th and basically goes those next 2 weeks. Beyond that, no one can answer questions right now about what competition might look like this summer and into the fall. There's no one that has that crystal ball right now. We are operating under the premise that we are going to be able to have a fall season. You might be operating under the premise that your school won't, and that's fine. We'll be trying to gather some data about what our schools may want with sports, but we really think that you need to first focus on opening school without the distraction of sport, and then let us talk about what might go on. Now, some of those discussions can parallel, but we have coaches that are already wanting to make August practice plans and wanting to do certain things, and that's all well and good in most years. As I have shared with everyone statewide, I truly, honestly believe that 2019 will look a lot like 2021, but 2020 won't look like anything we've ever seen or hope to see again. So if we can clarify anything, please let me know. I know we've had a couple of questions come in from specific superintendents about cooperatively owned properties and what can be done, and we've gotten answers out to those. We know, for example, there's a school system in the central part of the state that the building is owned, or the swimming pool is actually owned by the school system, but managed by the local parks. They're going to have to do some cooperative work. Same thing for tennis courts in about a third of our counties. We know you're going to have some very unique situations. We've tried to structure the guidance document to not bind you, but yet give you some guidance. But if it's not enough, we need you to reach out and ask for questions.
So Thank you, Commissioner Tackett.
Use anything?
Yeah, Tony, and as a reminder to all the participants, you can submit your question using the Go Soapbox link. I think if we can put that back up there with the KDE COVID password. Tony, do we have any questions that are KHSAA related?
Yes, we do. Hold on. I'm getting the information here. So they were wanting a PowerPoint from KHSAA, and I'm guessing it's not the PowerPoint that we have because it's just 2 slides. So, Julian, do you have another PowerPoint that you can share with them?
Well, we have the document that we sent out last Friday, and we certainly can send that to anybody that has a request there. I know that these 2 slides with that checklist were included in what Kevin sent out right before the meeting. But at this point, there's not anything else, but we have talked about developing a quick and dirty one for each segment. And as we go forward, that probably will be helpful as ADs and principals start meeting with their coaches.
Okay. The next question that we have coming in is why are the guidelines for athletics different than guidelines for other in-person school activities for schools? This has put us in a very difficult positions within our communities, and perhaps that's a dual question for both the commissioner and maybe for Julian.
Well, let me give you the first piece, Kevin, and then please feel free to expound. It's different from the CDC as well. There is a feeling when we sat in on 2 or 3 meetings with the CDC recently, one of the things they stressed was that school has people together in a tighter and longer time window without additional movement in some cases. So I think they're purposeful, and maybe they've just got staff that aren't talking to each other at CDC, but their guidance is different. And I think the most important piece was to try and as the various counties, particularly, I believe we've got more than 40 that border another state, as the various other states began opening up, there was a significant amount of pressure on the governor's office and others to try to see what could be done and what could be allowable. We still are going to be one of the latest states allowing anything at all. So I think that that's been the effort, is could we get the students back with those coaches? And Kevin, I don't know what else you want to do.
I think that's right. And, this really got started, the discussion got started with the youth sports piece of it by the governor's office. And then obviously, as you mentioned, Julian, about what was going on in other states, particularly Ohio, and the pressures being placed on those neighboring Kentucky counties. And then that morphed over into, I'm kind of reiterating the history over the last 2 weeks, Commissioner, and correct me if I'm wrong, KHSAA really needing to mirror and work alongside and parallel with the youth sports guidance about things that would apply to our sports. And so we have reached out to public health and the governor's office about districts, and we got this questions from several of you. Okay, so if my coach can meet with 10 or fewer athletes on the football field to just even catch up with them or talk to them, as Commissioner described, why can't the band director meet with 10 individuals going by those same guidelines? Why can't other clubs? And so we have received a sign-off that is okay for school districts to utilize those same protocols for other types of activities. That would also include summer school. For example, I know a district is planning on bringing students in groups of 10 or less, and obviously still practicing social distancing, but going by those guidances from public health that are also outlined in the youth sports document, what Julian linked to, for those other types of activities. Those things are not mandatory, and we also still believe you need to, even though we have a sign-off at the state level, you still need to coordinate that with your local health department, because there may be things obviously going on in your community or cases or an outbreak that we're not aware of.
The next question that I have that has been submitted is, do we have any guidance on band? And I guess that's in relation because of with what's going on with athletics. There's questions about band being submitted.
Kevin, you want first? Because I know I've talked to John once with KMEA, but I think they're kind of waiting to see what the further guidance is related to the more high contact, high volume sports with lots of participants like football or soccer. I know they're looking for guidance as well, but I've not seen anything issued on particularly like the marching band.
The only thing we have a green light for is what I mentioned previously, is the groups of 10 or less. And if you even just, the band director, it even just needed to have those meetings just to catch up with students, and you had to have, if you had 50 band members, you're going to have 10 meetings. That kind of thing right now is the only thing that we are aware of that's permitted. We've heard the governor talk a lot about the spittle or whatever it's called, from when we sing and use instruments. I'm sure that will be a factor in when bands can come together as well.
Hey, Kevin, this is Kelly. I think we might have gotten something on band at about 11 o'clock this morning.
Okay.
From the governor's office saying it is permitted with the following input from Dr. Stack: certain activities with higher aerosol risk, wind instruments at band practice must be outdoors and with increased social distancing of 10 feet. So I think that answers the band question. You have to practice outside, and there must be 10 feet between students that have higher aerosol risk.
Okay, I did not know that. We will get that rolled into the KDE guidance then.
Okay. The next question that we have is, okay, well, hold on a second. Somebody says they're having a hard time opening the YouTube site. Are we having issues? Has that been reported for this meeting?
Yeah, we've directed them to the help desk.
Okay, so that's just one problem that we've had.
Yeah,
So
there are 437 watching. We don't have any other comments about that.
Okay, I just wanted to make sure. So the next question we have is, will the KHSAA BOC need to take additional action for competition with low touch sports to actually commence after June 29th. And
Well,
they're saying, please keep in mind the difficulty with providing school bus transportation due to the COVID guidelines.
well, understand that there is no school against school competition allowed. Seasons are over. Now, that's also where we were very careful in the document issued Thursday to say they're going to get additional information before June 15th. And that is, we want to try to give them at least a couple of weeks notice. To around the state, there has always been a lot of informal summer play, but nothing that would have required a school bus transportation should have been going on unless a district did it on their own. So there won't be any allowance more than normal allowance. The debate will be, is there going to be restrictions to less than normal? Frankly, the focus of any resumption right now is to get people back out with their coaches and, help the psychological area. But once you get into real practice, once you get close, fall sports for any allowances, they've got to discuss scrimmages, they've got to discuss games, we've got to decide just exactly when can we get into actually playing sports. One of the real struggles in one of the sports is very seldom talked about. One of the real problems we have resuming football has nothing to do with what everybody thinks. It has to do with the fact we require a mouthpiece, and most kids put it in their hands every single play. And nationally, they're studying this issue. That's why you've not seen definitive guidance on even when colleges are going to start practicing, is they can't get past that issue with the health people. So there will be more information having to be given. The board has intentionally, and I have intentionally, been stepwise with this summer. We're not trying to answer August questions right now because we can't. So we're trying to answer them 2 to 4 weeks at a time. So that's a really good question. But right now, they'll have to give some guidance. And hopefully, this is June 2nd. Hopefully, the next week or so, we've got even more information from states that opened up play early and have already found problems, already found success. That's why it's good that we've taken the path, that the governor's taken the leadership path of not being first, not being last, but being smart.
I think you're muted, Tony.
Sorry. Another question, and this has been asked by 7 people so far, is what documentation do we need, or do they need, from the health department to start athletics?
That's going to be, I would ask you kind of flip the question of what documentation did you need to have a graduation ceremony or have a drive-by award ceremony, et cetera. So from them, that is a local relationship piece. We're not going to collect those. We're not going to police those, but that's such a liability risk that there's 100% faith that you're going to be working with it. KSBA, I have not talked to them in the last week, but I understood they were going to put out some documentation suggestions. I've not seen that in final form. Maybe Kevin, some of your staff has, of all of these things that are requiring consultation. What should you have to back you up? I guess my initial suggestion would be your board counsel to talk to maybe the folks at KSBA or others, and let's see what documentation we might want.
I agree with that, Commissioner. And we're trying to give you the state level guidance here at the department, knowing that there are certain things we can't get into just because they're local in nature, that your local health officials will advise you on. But the fact that we heard the guidance from the band issue today, and you can take that if you want to take that to your local health contact and say, here's our plan for band, and if they sign off, then in our mind at the department, you're good to go. Now, if your local health department folks are saying something different or not agreeing with what maybe was said here, and you obviously bring that back to us, and then we can help facilitate that conversation, or your local health department will want to contact the Kentucky Department of Public Health to get that worked out. But that's how we envision things like that occurring.
Okay, the next, they're asking why allow football equipment to be distributed during this time, as this is going to cause lots of issues, they say.
It is not allowed in either one of the periods, and it's specifically listed that it is not allowed. football equipment, helmet or anything else cannot be issued at the middle or high school level till further notice.
Okay.
We recognize those issues, and that's why it was prohibited in the guidance document.
And maybe I confuse that because I think I use an example of a coach meeting with the football players or something, but they can be meeting, correct, Commissioner?
Yeah,
they can
you are
be.
correct.
They can to have those interpersonal relationships, check them up how they're doing, etc.
You are exactly correct, sir. And that's what you want. But I can tell you from a couple of semesters of experience, the first time we allow them to put on equipment, all limitations are going to go away. So that's why we need to be sure that that is the last thing done with football in itself.
Okay, so just to clarify, football equipment is not being allowed to be distributed during this time.
You are correct. Yes, ma'am.
Okay. All right, I'm going to clear that one. The next question is, since KHSAA has pushed to open athletics this month, are you assuring us that we will have a fall athletic season?
There is no human on earth that can assure you, but that's what everyone's planning on, is having a fall season. There are no guarantees with this virus any more than I could ask somebody to guarantee what date they're going to start school and never have to miss. Unfortunately, that's the dilemma we're all in. But I think it's our duty to plan for the fact that we're going to have it. Now, I will say this, we're not being responsible if we don't look at alternatives. We don't ever want another repeat of the spring. So is the alternative a real shortfall later on? Is the alternative to play the fall sports at a different time of year? Is the alternative to do something else? Don't know. Not on June 2nd. But every single thing is being looked at. But I don't think anyone can make assurances or guarantees right now. I don't.
Question that we have, I'm trying to see if there's another one as it relates to athletics. Trying to see, I'm just looking through here.
Really?
Is there a mask requirement when coaches meet with students outside?
Again, if and I know you all assign this to staff, but if you look at the governor's documents, if you look at the CDC documents, any non-participant, so in other words, non-student, should be wearing a mask under the social distancing guidelines right now. That means when a coach is giving instructions, et cetera. And I go back to something Kevin said a minute ago, that when we were talking about the bands and the music. When you talk about the projection of aerosol out of mouths, et cetera, there's probably no better example of that than a coach hollering and screaming. That's exactly why they want the mask on those adults. Can we slow that down? Can we slow those particulates down? And I've already heard from a couple of coaches say they can't wear a mask. And I said, my response was, you're probably going to have to talk to your AD because you may not be able to coach. You're going to have to use the social distancing practices right now.
I'm going through again, just give me a second. They're wanting to know, we'll send out the guidance for band, and yes, we will do that. We just literally found out about that this morning, so we will get that out to you. Looks like I don't know if this is a spelling mistake. They're saying something about segment 3 that protective gear may be provided to student athletes.
For certain things, there's a note, a very specific note that says football gear cannot be issued. In segment 3, when you get into the soccer goalie, remember there's 18 different sports and championships. So it's important that you don't pigeonhole read everything to be protective, but there are certain things to show the shin guards for the players that play soccer. There's goalie equipment there, and there's also baseball catching equipment. Those are all protective gear, but football is specifically prohibited.
And they're also saying, in response to the mask question, they're saying, doesn't the guidance also imply that adults cannot be made, and made is in capital letters, to wear a mask?
That's going to come down to the local level, but I would not want to be the administrator that told a coach that he didn't have to wear it and then had an outbreak. We're giving a guidance document that you have to decide how you apply it locally. And I think one thing I've heard said on every one of these, just like most of the other presentations of a couple of other groups that have worked with the department on this summer, is there's not going to be an ironclad definite on any of this. This is best practices. This is suggestions that if you don't use, there's liability involved. You've got to decide and implement, and local schools have to decide and implement at the local level.
And I know it's a whole other ball game when we're, no pun intended, when we're talking about keeping masks on kids, but you know, we're educators and administrators and value education and science and research, and the mask requirement is coming from scientists and doctors that this is their expertise, and they are trying to guide us in the best possible way to help slow and prevent the spread of it. So I would hope that as school officials, we're able to at least model that, knowing we're going to have trouble on the other end of it and enforcing it, and knowing that's going to be an issue with our students. And we also know in public health, they've been very clear there are exceptions for adults wearing, or anybody wearing masks that have other complicating health factors. That could be a reason why the example given at the commissioner addressed that person might still coach if they have another complicating health factor.
All right. The next question or concern that has been brought up is, well, it just got moved. Social distancing on buses for away games is going to present a huge challenge for every school. Has there been any discussion on how teams are going to be transported?
Well, before the commissioner answers, just know that we have been talking with public health over the last week as a result of that issue being brought up, not specific to athletics, but just in general about bus capacity and limited resources, limited drivers, limited everything, and reducing that capacity and how that's problematic. Public health has been going back to the drawing board to see, and I don't want to speak for them to say whether it's been approved or not. We hopefully will find out today about some options that would allow greater occupancy of a bus up to full capacity if certain conditions are met on the public health side. So that has been heard by public health as being problematic. That directly relates to that question, Commissioner. And we're still obviously hopeful that we can get some guidance that will permit that and ease that for districts.
Well, I agree, Kevin. I think Dr. Schultz made a really good point this morning at the Interim Education Committee about the transportation problem, representing a lot of our school administrators. And our only answer would be, if whatever solutions come up with for transportation to school is going to be obviously paramount, and we can then take that and use it.
Sorry, I was muted again. Sorry, I apologize. The next question they have is wanting to know if there are specific guidelines for the weight room. For the weight.
Probably the most detailed guidelines you've got are about the weight rooms. And frankly, I've had a chance in the time I've been at the office to be in just about every school, and our schools' weight rooms are going to have a tough time meeting the guidelines. The guidance requires that they meet the guidance for fitness facilities that just went into effect yesterday. And that includes a lot of sanitation, a lot of spacing, a lot of social distancing. If you look at the governor's order on youth sports, there is a section specifically on weight rooms. Our guidance has non-conflicting specific guidelines for weight rooms, and the governor's order related to fitness centers. It was originally called gyms, and that's where the confusion came out, was when the first announcements were made. They called gyms. They changed it to fitness centers. But those places have to meet that. The biggest problem they're going to have is size of most schools' weight rooms. When teams like football teams that have a lot of people all try to get in there, they're not going to meet the social distancing guidelines that are required. So please take a look at those 3 links. They're really detailed, and they give you an idea of what is expected. And at the same time, going back to the quote that was the first thing in the slide last week from the governor's health people on the fact that you've got to guide by what's feasible, what's practical. That sentence that the CDC put in their resumption guidelines. That's something you're going to have to look at individually and whether or not you can meet. There are a number of criteria for weight rooms.
Anything else, Tony? If not, we will move
No,
on.
there's some more. Sorry.
Okay.
They want to know if Commissioner Tackett can clarify the following: off-campus participation by enrolled or formerly rostered participants with or without the presence of a school coach,
Yep.
whether or not coaching shall be unlimited.
Yeah, let me make sure that that's clear. In the original shutdown period, the rules did not allow a student to even play for a travel team or an outside team. That ended April 30th. So that statement has been in both the May guidance and the current guidance. So during these periods, the KHSAA rules have nothing to do with a kid playing on a third-party team out of state. And that's where probably 90% of the inquiries came from. I know that we have 80,000 rostered participants last year in all sports, and I'm pretty sure that 60,000 of the parents have inquired about what restrictions were on their kid when they played out of state. And through the end of April, because we were in that period when no one knew anything, working with the governor's office, that was shut off. And beginning in May, outside play is governed by the parents, governed by what you allow, and at least during this summer period, not restricted. Now, there are other restrictions that kick back in once the school year starts, but again, we're talking about this time frame, and we'll need to do one of these documents for the next couple of weeks and the next couple of weeks, because I suspect the increments will gradually change. So I hope that kind of made it a little bit more clear.
Okay. The next question, let's see here. I'm trying to see, just make sure that these are not, their suggestion is assume local decision on how to record temperature checks and symptom checks for coaches and athletes. I'm not sure if that's a question or just a comment, but I just wanted to go ahead and say that so that we can check that off here. And then another clarification one more time about football and basketball as far as competition and practice. Is it not being allowed yet and only gathering for relationships and conditioning?
Yeah, let me answer those two specifically, if you don't mind, Tony.
Okay.
The 1st through the 14th, nothing at all athletic for anybody. When you get to the 15th through the 28th, both football and basketball, because the governor labeled them as high contact, can begin conditioning activities. That does not involve equipment. That does not involve basketballs. That does not involve lining up in an offensive line formation. That is conditioning, where you're assessing their physical conditioning, getting them in the weight room, etc. The 29th of June is where things could change, but that's why we said when we released the original document that more information will be forthcoming as we get more from the Department of Health. And I think you see just exactly today with what came up with the bus situation. We're all kind of at the mercy of that last minute additional guidance. We'll then get it out. We feel pretty comfortable about the 1st through 14th information not changing. We feel pretty good about the 15th through 28th. But beyond that, when you get into June 29th and beyond, it's going to come down to virus, how much testing we're getting, what's our rate, have we got medicine yet, have we got, what's the talk on vaccines? There's all kinds of things that could factor in and make a change in the 29th. So I hope that clarifies the 3 periods. Yes, sir.
And Commissioner, I had a similar flag that I received here from a superintendent, a screenshot from, I think I'm not sure if it's from the youth sports document or a KHSAA document, but in line with what you just said, from the 15th to the 29th, for football, a player should not participate in drills with a single ball that will be handled off or passed to other teammates. Contact with other players is not allowed, and there should be no use of tackling dummies, donuts, sleds, etc.
Yeah, it's really about general conditioning and assessing condition. The biggest fear that the sports medicine community has right now is that the average Joe who could not play in his local little league, could not be in the weight room, could not be anywhere, will come back out, try to go full speed, and we'll have a bunch of heart problems in our state. That's the biggest fear of the sports medicine community, and that's why you're seeing this incremental approach. Can we get organized, give out our paperwork, talk about this give out physical forms? Can we do all of that? Then can we spend 2 weeks assessing and getting them started toward good conditioning? And then let's see what that next phase holds.
Okay. Several of you asking for a copy of today's PowerPoint, which should be in your invite, which is on your calendar, but I just now just sent it out to all state superintendents and finance directors, so check your email. You may have had to refresh your calendar. We were waiting for some information to submit to the PowerPoint at the last minute, so you should now have that. So that should take care of a couple of questions. Follow-up question for Julian. So is basketball conditioning outside until the 29th?
It's outside until further notice, because right now there's no date set for opening gymnasiums.
Okay, same thing for volleyball, soccer, and cheerleading?
Same thing for volleyball and cheerleading. Soccer does have the outdoor conditioning. The outdoor high contact sports have some things very specific. Right now, the gymnasiums are what are still closed down.
Okay, they're also wanting clarification issues around bylaw 23. Do we follow bylaw 23 or is it obsolete?
Okay, 23.
I don't know what 23 is, so I'm just.
23 is the limitation of seasons, so they might be misreferencing one. I can tell you that 24, which was the part of 24, deals with a period from June 25th to July the 9th. It's been the dead period every year for the last 26 years, I guess it is. And that has been set aside for this year because the governor, right in the middle of it, allowed play in baseball and softball. And what the board did not feel comfortable with, the more they talked about it, was starting for a couple of weeks, shutting down, starting back up, and what the pressure that was going to put on you all locally. Frankly, most of this is to give you some options and let you make some decisions locally. We have a number of areas that have been very seemingly unaffected by the virus itself, and their families and everybody else are wondering why we're not out there playing. And there's others that are like, we don't want to play till October. We know that variance exists. And as they looked at it, that's why they set aside the dead period. It was not a unanimous vote. It was a split vote. We had several board members that didn't feel comfortable eliminating it, but most of them that felt comfortable did not want to play a couple of weeks and tell the parents, oh, while the little leagues and travel ball can keep playing, we're going to shut down for 2 weeks and come back. And it just they didn't feel like it made practical sense when they tried to represent your interests.
Okay.
Okay. So Tony, I think in the interest of time, we're going to need to defer those additional questions until the next week or get them over to Julian. Well, we'll get them to Julian today and he can answer them, or we will also answer them at the beginning of next week's question and answer section.
Okay, we may have some time towards the end. I'm not sure if the commissioner can stay on until the end, but we may have some time at the end as well.
We also have the hard stop with the governor's press conference, so we're going to be pushing it today.
All right.
So Kelly, Commissioner, thank you for being on. You're always on every week anyway. You're on the other side of it, but sounds like we'll need to bring you back several more times just to answer some questions as we move forward.
Glad to do it, Kevin.
Thank you. Dr. Foster, are you going to, I think, introduce our next two topics?
Sure. I just wanted to remind everyone that we released 2 additional pieces of guidance yesterday. One is about evaluating students and their academic readiness when returning to school. The second piece is academic reentry, looking at adjusting your curriculum moving forward. And so we have some folks from Jennifer Stafford and Krista Hall will be joining us to go over these 2 pieces of guidance. They went out in a press release yesterday. Superintendents, you also received these in an email, and they are also posted on KD's COVID-19 page under KDE resources. And so, Jennifer, I will turn it over to you.
Well, thank you, Kelly, and good afternoon to everyone. As Dr. Foster mentioned, that we have released information on students and evaluating students upon the return of students to school in the fall. With the fact that Kentucky applied for a waiver from state assessments as well as state accountability, and we did receive approval for that, that waiver, we will not have a lot of assessment data to release this fall. And without that piece of assessment data, we want to make sure that you realize and are able to utilize the data that is within your schools and districts. So schools and districts should consider the other ways to determine the gaps in learning that may have happened and the strengths and weaknesses in areas of growth of our students. So the evaluating students academic readiness piece of guidance was really written to touch on 3 points. The first being that with the absence of assessment data, that there are data that districts have to make curricular decisions, to really challenge when and how to administer the school and district local assessments, as well as encourage our educators to make informed, data-driven decisions. So the impact of NTI is really unknown, and therefore it's important for us to determine the academic level of our students when they return to school and determine what their academic needs are. So with that, we encourage that one of the first steps when the students get back to school is to evaluate and use the assessment data to help guide curricular and instructional-based decisions for our students' needs. So there are different types of assessments that the local school districts have. Diagnostic assessments, such as the administering the MAP assessment data or the STAR. Many of our schools and districts purchase those. Those are administered at different times within the school year and provide guidance and direction for the student-specific needs. And so those are sometimes administered later in the fall or winter and then spring. But you may want to consider going ahead and using those assessments earlier upon the return of students to school so that you can gather that information more quickly. Also, teachers have their classroom assessments, and those are used generally at the end of a unit, but those can be utilized toward the front of the school year for more of a pre-test and to gather information on the students. Local schools and districts also have developed interim assessments. Local schools use these for, again, student-specific information to guide information toward the students' learning. And those can also be used in a different format toward the beginning of school so that, again, curricular decisions can be made based on that data. Finally, the formative assessments that are given on a routine basis in the classroom, such as answering questions back and forth, and that observation of the teachers is going to be very important during this time when students return. So again, all of those pieces that can be gathered at the local level to help administer and understand as we make curricular decisions. Now, when and how the assessments are administered should also be considered and is one of the pieces of guidance in the document. With the return of students to school in the fall 2020, it's going to look different. As we just heard Dr. Tackett talk about the return of sports, returning to school also is going to look different. And those tests, although they have some technical guidelines that have always been used, you may want to consider using those in a different aspect or a different time frame and give yourself some latitude on the variety of ways that they can be administered. For example, our assessments are generally administered in person, and those can continue to be that. But you also may want to consider using students and administering those in a virtual administration. So students may take the assessments that could be supervised virtually through maybe a Google Meet application or the Teams application that we've all lived on for the past few months. So want to provide that guidance that can be looked at with other possibilities for administration. And then you also have the mixed model. You may have some students in their classrooms in person and others that are virtual. So again, just thinking differently about how and when those assessments are administered. And then finally, once the students have been assessed, then teachers will have that data to make data-informed decisions. Use that data to analyze and collect that information so that the analysis can be made, and then the interpretations of that data around the student's strengths as well as those areas of growth. So again, use that good data and make curricular decisions that are data informed. So we really hope that this piece of guidance provides helpful information to determine strengths as well as areas of growth for our students as they move into the 2021 school year, and that our teachers can plan for what happens next in their classroom. So at this point, I'll turn over to Krista Hall, who has is going to talk about reentry on stage 1.
Thank you, Jennifer. Appreciate that. Recently, we hosted a 3-part webcast series on academic reentry. And the focus of this was to provide guidance for our teachers around being able to analyze the content and the standards that they were able to teach during the 2019-2020 school year, and then having a step-by-step process that they can use to help guide them in adjustments that they would need to make for their 2020-21 curriculum for the fall. And so, regardless of what the fall is going to look like, whether that is going to be a face-to-face format, a virtual format, or a hybrid model, or even if it's going to change as the year starts, this foundational work that our teachers can be doing now will be applicable regardless of any of those models. So I want to invite my colleague, Misty Higgins, to share some more specifics from that guidance to help assist our schools as they're moving forward.
Yes, and we know that there is a lot of guidance coming at you all right now, and just know that the work that's laid out in this particular guidance belongs to the teachers. And like she said, it is a very step-by-step, easy to follow process, but it does not mean that the work of that process is simple. It is a heavy lift on the teachers, but the goal was for the teachers to really be able to walk into this next school year with at least a high-level plan of a curriculum in place that can help address the current situation that we're in. And so as they follow that guidance, the goal is in stage 1 for the teachers to work together in either their grade level or their content teams to really do 3 sections of work. The first section would be where we would have them sit down and look at their 1920 curriculum. So what was in their curriculum this current school year that just wrapped up, and then analyze that against the Kentucky Academic Standards document to see what is absolutely necessary for us to keep in the curriculum for the students next year to ensure that they meet the grade level expectations of the standards. Because essentially, we're going to have to carve out time to be able to address the gaps that we know students may have because of the extended remote learning. So in section 8, it's just guidance on how do we really sit down and analyze what we have to keep in order for students to meet those grade level expectations next year. And hopefully in doing that, they're going to, like I said, create that time to address the gaps. And the reality is every year as teachers, we add to and enrich our curriculum. And so we are going to have to look for places to really tighten up next year, at least in the beginning, knowing that as we move forward and we use the formative assessment process in our classroom, that we will likely find some time and opportunities to include some of those pieces we may have to initially cut out of our curriculum at the start of the school year. So that's section A. What do we absolutely have to keep in order for students to meet grade level expectations next year? Section B is where the grade level team, they sit down together and they're looking at, for the current kids we just had, due to the extended remote learning, where do we think those gaps are going to be? In which particular content, concepts, and skills tightly aligned to the standards, where do we feel like those gaps are going to be? Because they're going to share that information with the grade level above, so that the grade level above can help put that in the curriculum for next year, so that it's not a guessing game. It's not just assuming they didn't come in with anything or that they had it all. It's information that is telling them this is where we anticipate those gaps being, because these are things we taught only during remote learning, or it was in our curriculum tightly aligned and we didn't even get a chance to teach it this year. Whatever that might be, there's a step-by-step process for identifying where those gaps might be and then passing that on to the grade level above so that they can build that into their adjusted curriculum for next year. And then that's what section C is really all about, is taking the information from A and that information from the grade level below in section B and using those two pieces to draft that adjusted curriculum. So at least at the start of next school year, we have a plan of what at a minimum we have got to be able to teach our students to both address the gaps and to meet the expectations of the grade level standards. And so like Krista said, all of that information we've packaged together, and we do want you all to know, if you were a part of that web series we did back in late April, early May, the one update that we made to the guidance document that is now available is we embedded a page of those leadership considerations. So even though the work of this is on the teacher teams to really complete, there are some considerations around how can you as leaders support teachers as they work through that process. So anything you would add, Krista?
No, I just want to reiterate that, as Kelly said, this guidance came out yesterday, which had those leadership considerations that you were just mentioning, Misty. And so that did go out through the commissioner's Monday message. And we have had some feedback from some districts that have already started this work. And as their teachers are working to plan for the upcoming fall, them being able to use their expertise around their academic standards, their content, and their curriculum is really giving them that foundational piece for whatever our structure is going to be in the fall. And it's allowing them to move forward while we're waiting for some decisions to be determined. And so with that, Kelly, I can turn this back to you.
Okay. All right. Are we gonna, do you want to?
Yeah, let's proceed. We'll defer questions on. First of all, I want to thank Jennifer, Krista, and Misty. That's a lot of information in a short amount of time, but some really good information in both of those guidance documents. So thank you so much. Superintendents, please make sure you're forwarding those on to your actually, I think the UPS driver is about to get attacked by my dog. So make sure you're forwarding those on to your staff. So we're right on schedule with the Department of Public Health. Could only be with us at 3 o'clock, do an engagement. I think they are on. We have, again, Dr. Connie White, Dr. Emily Messerly, and Rebecca Gillis. We'll turn it over to you, and I'm going to jump off real quick to make sure I don't have a injured UPS driver.
Hello, good afternoon, everyone. This is Emily Messerly. Thank you for having us again. For those of you who weren't on the call last week, I am a nurse practitioner, family nurse practitioner. I work part-time at Baby Health in Lexington, Kentucky, and I'm a mother of 3 children in 3 Fayette County schools. So I'm very pleased to be able to have this opportunity to give the superintendents this public health guidance on return to schools. And we are very, very near having our guidance for schools document ready to distribute to you all. We will give that to the KDE leadership before it is distributed, but we have gotten approval from Dr. Stack from what we have written up so far. And I listened to the first half of this call, so I know that sports is big on everyone's mind. Extracurricular activities are big on everyone's mind. And I wanted to let you know that we did get, just this morning, we had a meeting with Dr. Stack, and we did get approval to utilize the buses without the social distancing. So that is something that that for both schools and sports should be a relief to you all, that we will use a layered approach of giving the masks and hand sanitizer, but that buses, we understand it's just not feasible to have students sit one per seat. I also wanted to tell you that in relation to after school activities, so in some of the original CDC guidance that we made our presentation off last week, it specifically said, no extracurricular activities and no field trips. We want to be in line with the guidance of group size. So, and Dr. Stack made a great point also. If we're allowing after school sports, why can't we allow other after school activities? So we are writing that up, that with social distancing guidelines and group sizes in coordination with the state guidelines, that other after school activities will be allowed.
Isn't it? Hi, this is Connie White. I'm sorry. I believe the 29th of June is when we're anticipating 50 or more groups. So, because right now we've got 10 or more. So this will be an opportunity for some of those after school programs that Emily's talking about. So it just this is all about trying to do things that just make sense.
And Dr. White, just to catch you up, I did tell them just sort of the two main issues I think that we addressed with Dr. Stack this morning regarding the buses and the extracurricular activities.
Right.
And that we would be providing guidance in writing by the end of the week, because we want to review it on Thursday with our KDE leadership team. Is that correct?
Yes.
Okay, great. And then I want to point out also that you all, at the bottom of the slide, you will see this was a great idea. I think my colleague Becky Gillis came up with this idea. We established an email. So it's an email that will actually be manned by a small group of us, probably just us three right now have access to it. But it's a way for you all to have an easy place to ask a question, and that's something maybe specifically to your district, and then we can answer that question. What we will do is, as those questions come in on a regular basis, on a rolling basis, we will then establish some FAQs based on the questions that come in, so that we don't get repeat questions. And then we'll make sure that someone at KDE distributes those FAQs to this group.
And before we respond, we'll run this past KDE, so you guys know what our thoughts are on an answer, and to make sure that we're not off base about anything.
I noticed, if Becky is on the call, I did notice that there was a question in the soapbox that was a little bit higher up on the list, and it was specifically about plexiglass and how that, if schools were able to do that, if that would change the numbers of students in the classroom. Becky might not be on. Is that something you can address, Connie, or should we wait for her to come on?
Well, I guess, so the question is, if you had plexiglass between students, could you get them closer together than 6 feet? Hadn't thought about that. Don't know. Kind of makes sense that if you're trying to separate people, that might be a certainly reasonable thing. But so that I don't give you the wrong answer, I think that sounds reasonable. But before I say absolutely yes, let me run that by. Becky Gillis is our environmentalist, so she would be the person that I would lean on for an exact answer. But that's really out of the box thinking. Those are the kind of creative things that we would love to hear from all you guys, because you're the smart people in the room about this.
I think it's a great idea, and I'm certain that there are probably manufacturers out there chomping at the bit to give you a bid. That's something I just don't know if all schools have the finances for.
I'm writing it down.
So Connie, Dr. White, did you have any other specifics that you wanted to bring up before we moved on to questions?
Well, Commissioner, do you want us to look at outstanding questions from the webinar that we were sent, or how do you want us to proceed today?
We want to try to get as many questions answered on the webinar as possible. And then, of course, there will be some that you all will need to confer on that will defer, that will either end up in the guidance document, I assume. And so and then bring me up. Sorry, I had to take care of something really quick. It's all okay. So you all will be, the public health will be issuing the guidance document that we've been anticipating about reopening the sanitation and a lot of those things for reopening schools by the end of this week. Is that what I heard?
That's what we're hoping. We're hoping to have our document ready by Thursday. And then what we are planning on doing is getting it to the governor's office so they can put it, you've got the healthy at home format, you've got the healthy at schools format. We'll have that in a healthy at work format. We'll have a healthy at schools format that way can be posted on the website with the governor's office's blessing.
Okay,
so I don't
great.
know.
And I think,
I don't know
a lot of our superintendents.
I don't know that we'll have the governor's office piece done by Friday, but we'll certainly by noon Thursday, what we've put together, we'll get our Thursday morning team to look at, get it by you, Commissioner, to be sure it meets your satisfaction. And then we'll get it to the governor's office to turn around into a format that's easily read.
Right, and that's what a lot of our superintendents have been kind of looking for. They've obviously seen the Healthy at Work document because that also applies to districts as an employer. But superintendents, you heard that will be the Healthy at School format with the public health information will be in that same format that you're used to seeing as the Healthy at Work document. I think will provide a lot more clarity for you. And then will that also be the document that contains the bus guidance, or that be okay?
Yes.
It will. Okay, great.
And another thing, those Healthy at Work documents, and since you probably don't check the website as regularly as we do, those Healthy at Work and all the different health at whatever it is, those things are changeable. So if we post something and something is just like off the rails, I don't think there will be anything, because I think our Thursday team from KDE would point that out. But if something changes or something just isn't workable, that isn't etched in stone. That can be changed. And so the things that have been put up on the governor's website or our kycovid19.ky.gov website, they change all the time. So if you see something that particularly puts your hair on fire, please let us know, because it may be an unintended consequence that none of us thought about, but maybe it applies to you, so we can make those provisions so that it's workable for your school.
And we are going to, obviously we have this webcast every week. We are now having a superintendent advisory council every other week. And then the weeks we're not having the superintendent advisory council, we're having the education continuation task force. So we have ample opportunities through multiple formats to start vetting this for, a lot of it's already been vetted, but as stuff starts being put into operation, when districts start running into problems or roadblocks, then we have several venues that we can generate that back to you, that feedback. One of the things before we get into the questions I'll bring up, that's probably also a question, but hearing today from some superintendents, and it came up a little bit, or was implied a little bit in today's interim joint committee about cultural issues around the state, or at least that's how it's being termed, and we've all experienced it. For example, I'm here in the country, and there's a Dollar General store down the road, and when I go to the Dollar General store, I have my mask on, and the employees have their mask on, but nobody else has a mask on, and that was as recently as last night. And maybe that's a cultural thing because of where we are. It's the country, that kind of thing. So the point that some of the superintendents have been making is that they believe they have cultural influences at play, or call it what you will, where parents are really not going to be encouraging their children to wear masks to school, and will not be probably reinforcing, for whatever reason, the district and the school in requiring the mask. So can you all help walk us through that? I know we talked a little bit last week about how these are recommendations, that these are, we have to do things where it's feasible. It's not feasible to have a mask on every kindergarten student, every second grader. They're going to come off. They're going to throw them in the floor. But where's the line between, what's public health stance on that? If districts are going to have trouble, and the students just basically say, I'm not wearing a mask, or the parents, or they say, my parent says I don't have to wear a mask.
Well, I think the place that I would see you would want to be pretty strict with would be on the bus. I mean, we're saying you don't have to do the 6 feet if you've got the mask on to make up for the lack of social distancing. I think look at what schools have done in cultural changes just in the 65 years that I've been alive. And how many things when I started first grade are very different now. And the reason they were different is because schools had expectations. And they may have been higher expectations than the general public. But I think this is your opportunity to set those, the best practices for the healthiest people in your community, your students and your staff. And so I think you have expectations. I think you have preferred standards. You're not going to expel a kid for not wearing a mask, but I think if enough of them wear masks, then it's going to be kind of odd for the kid that's not wearing a mask. And I think at first it's going to be more difficult, but I think over time it will become a norm that people will be dealing with. Like I said on the last call that got picked up by the press, I mean, we're not going to have the 6-foot police. We're not going to have the mask police coming to your school. But I think if the superintendents understand, and I think they do, that respiratory droplets, the primary way this spreads, and the more you can get compliance, the healthier your community, your school community is going to be. And that's all you can do.
This is Emily Messerly. My other recommendation would be that if there are students in the classroom who are creating difficulty or creating a scene with not wanting to wear their mask, the important thing for the teacher to do would be to make sure that the other students sitting around that student are wearing masks. So that, if you want to talk about herd immunity, because there may be a classroom where a few of the children aren't up to date on their immunizations. I certainly wouldn't hope that's the case. But when you think about that, when you think about herd immunity or herd protection, if there's one student not wearing a mask, as long as if it's going to cause a behavior issue, as long as the children around that child are wearing a mask, you're protecting the most possible.
Something that we think will be and we're always talking about unintended consequences. I think the more of this that we do to prevent COVID, I think you're going to find that you're going to have less flu this year. Because Emily's staff did this dramatic chart that I'd like to share with you guys, and it shows flu each week the month of March and the first week of April last year and how the numbers went down, as it does over time. But if you look at this year, when we started doing the Healthy at Home initiative, I mean, the number of flu cases just dropped like a rock because people were not exposing each other to these illnesses. So I think you will probably find less flu, and that will give you more days you can be open.
So Tony, why don't we go ahead and start with some questions, and we'll go for about 20 minutes, and that way we can get through our other topics, and then obviously have a closing question and answer session. If folks from Public Health can stay on after the first 20 minutes, then great. If not, we will defer those to and forward those questions to them.
Okay. Well, there's just one observation here initially, is that they were wanting to know if they can have a healthy with sports document. So that's maybe something to consider. So that's the first one out of the gate. The second one that I can see here, let's see here, I'm looking, we addressed the glass. They were wanting to just some clarifications on the bus and transportation restrictions. That might have been a KHSAA question, but and I'm not sure what you all can share, particularly on what you've come up with the guidance on the buses, without going into detail on the document. But perhaps you can, since you kind of let it out of the bag a little bit, if you can kind of share that with them today, just to let them know, because I know that was a big point of contention in terms of this is just not going to be possible. Perhaps you can share a little bit more about the guidance for buses.
Well, I think if you look at the 6 feet apart social distancing guidance, and it says if I go to the pharmacy and I can't be 6 feet apart, then I need to be wearing a mask so that I don't infect others. So if we're doing that in Kroger's and we're doing that in the pharmacy, then if you've got a transportation situation where you can't put kids 6 feet apart, then if they're going to be closer together, you try to cohort households, like we said, but that they need to be wearing a mask so they're not infecting others. Again, we're trying to think of some logical, common sense things. So we don't want you to cram 3 adolescents into a 2-person seat, but you wouldn't be doing that anyway. So that'll be a way that you can work close to capacity on your bus, but make sure that the kids are not potentially infecting each other. Is that clear enough, or am I talking in circles?
I think that clears it up a little bit, and I think that once they get the guidance document, it'll be more helpful for them to see. I think a lot of the questions I'm looking even on the Google Drive, where they were able to submit some questions as it regards to buses. It's just I think they're just wanting specific numbers in terms of numbers of students. Can we have whatever the approved numbers of students is right now to put on a bus? Is that still allowed, or do we need to look at possibly more bus runs, or things like that? What are things that they need to keep in consideration as they're planning for reopening schools and getting kids to and from school?
If you've got kids with masks on, then you can use your bus. Is that, Emily, Becky?
That's correct. Masks, so it's a layered approach. Masks are going to reduce transmission. Hand hygiene is going to reduce transmission, and temperature and symptom checks will reduce transmission. You also have to think about it as bus rides. Yes, you're in a confined space, but it's time limited. In the classroom, we can't have students being on top of each other because they're in the classroom for 7 to 8 hours. The bus ride is less time, so less of an exposure. We decided that the best public health guidance is masking, hand hygiene, and checking for symptoms.
Okay, and then there was another question. Are they still going to be expected to take temperatures prior to students boarding or getting on a bus?
That is in our recommendations, but we will see if that continues when it's finalized.
Okay. And then with the sanitizing, proper sanitizing and the masking, that obviously means that they will need to provide those things for children.
No, just like for attending school, as we mentioned on our presentation last week, cloth masks, it would be expected that just like now when you go to Kroger doesn't give you a mask, but that the cloth mask be provided by the family, but that the schools and the buses, of course, keep masks on hand, because obviously some children are going to show up without a mask. And then the school should have some supplies available.
Okay.
Probably the Family Resource Center can coordinate.
Okay, and then another, I guess this is just a comment. The ability to manage and ensure kids are wearing masks on the bus is going to be extremely hard or problematic, they're saying. So just another comment they're mentioning there. So
sure. Well, if we don't enforce the masks, then we would have to do social distancing on the bus without masks. So it's a tightrope walk, you know.
Right. And then there was just a clarification. Did you say that if masks are worn, then the 6 feet social distancing is not required?
Just on the bus.
Just on the bus.
Not in the classroom.
Okay. So that's just on the bus. Okay.
Just on the bus, not in the classroom.
Okay. I'm just looking over to make sure I don't have any other health questions on here.
And again, because it's a short exposure. It's just, it's a 45-minute ride maybe versus an 8-hour day.
Okay, what if a child has a temperature prior to boarding?
We address that specifically in the document.
Okay.
We'll have details about how to handle that.
Okay.
Our thought was that getting on the bus is essentially getting on school property. So once you take the kids' temperature on the bus and they get unloaded at school, they don't have to get rechecked again. So that you won't have to double temperature them. But hopefully that they'll be brought to the bus stop, and if there is a fever greater than 100.4, they can turn right around and the parent can then take them on back. There will need to be some kind of a plan in place as to what do you do with this kid with 100.4 temperature, and whether that's a certain seat on the bus in the front right behind the driver that you can keep them separated from everyone else, and then when you get to school, what you would normally do with a child that had a fever that you would be returning to their family. And I'm assuming those protocols are in place.
It might be an appropriate time to add in here, Tony and our public health folks, as well as Rob and Kenny. Kenny and I had a discussion about this yesterday. Districts are permitted to buy off the state contract for personal protective equipment, including the types of paper masks that we're talking about, not the N95, for that kind of use, as well as, I believe, through their other purchasing mechanisms in bulk through their cooperative purchasing. We also know, just anecdotally, we're hearing from some districts, some community organizations and nonprofits and various groups are making the cloth masks as well.
I heard of one school that every grade's going to have a different color. I heard of one school who the community is doing masks in school colors, so you can be sure and have your fighting tiger or your bear or whatever you are.
And an important point too is that we added that cloth masks, especially at the middle and high school level, be treated by your SBDM as part of the dress code, so that students are not coming to school with inappropriate images on their masks. So you should treat the mask just like you would the dress code. It's my I would envision, going forward, that masks become almost something like underwear. You better have 5 pairs to get you through the week, and then you wash them on the weekend. So that's, I think if everybody gets into that habit, and especially if you have community partners making masks for students who don't have the ability to purchase them. They could be distributed at school to the children with free and reduced lunch, and they take them home every day, launder them on the weekend, just like they do with their clothing. And they have one a day for the 5-day week.
I think you're muted, Tony.
Yeah.
Sorry, my child decided to do laundry while I was hosting the webcast, so I've got the, I
was just talking about laundry.
Right, but I'm just like, so sorry.
Yes.
Some ball games, there's a question in regards to the buses and masks. Some ball games are hours away. Are we still allowed just to wear masks during this, with it being such a long transport? Are they just allowed to wear masks during that time?
That's a great question, and I would imagine that by the time that sports are fully opened up where they're competing regionally, that perhaps we'll be in a better state with this, but masks is what would be required. I can't see us adding anything additionally.
Okay.
And they could always travel in a personal car with family if they wanted to do that.
Actually, I have seen that. I have seen that in the guidance, that because sporting events tend to be farther away than the short distance from home to school, that switching to a carpooling model, not only does it help public health, it helps the bottom line. I know my daughter's basketball team at Dunbar, that we did all parent carpooling, and it saved us a lot of money with paying for the buses.
But everybody's parents don't have a car, so.
Right, but we drove the children whose parents couldn't give them a ride. It was a carpool.
They would have to wear masks if they were in your car.
Right.
Everybody would have to wear masks. Okay. It wasn't just your kids.
Yep.
Right, because these are just for the bus. This is just for transporting on buses. Correct. Question on lunches. Should they still plan for lunches in the classroom?
Yes.
Okay. From a health department standpoint, I know we had questions in terms of the teachers and stuff like that, but that's going to be for us to figure out.
Right.
Okay.
Right.
That limits the congregate activity, a cafeteria, and you cannot wear a mask while eating. So you really have to stay cohorted with your classroom.
And I had forgotten I had my mask on, and I've tried to eat with my mask on several occasions, and it just
doesn't work.
Okay, let's see. There was another question about the plexiglass. Many classrooms have tables instead of desks or computer stations. Would it be okay to use plexiglass to divide these areas since they can't be moved 6 feet apart?
And Becky, now that you're on, would you address that?
Yeah, CDC does give some guidance on physical barriers, and they do recommend that there be some physical barriers such as sneeze guards and partitions. It says particularly in areas where it's difficult for individuals to remain at least 6 feet apart. And they give the example of like a reception desk. These things are, they're probably quite expensive. I don't know how much they cost, so I don't know how feasible that would be for a student situation. I do know that the State Emergency Operations Center ordered a few for the Emergency Operations Center there for people working at their individual desk, and it was just a plexiglass that went in front of them and on the sides of them as well as they're sitting there in the Emergency Operations Center.
I just received a message from one of the co-ops that does purchasing that they will be or are looking to do masks as well as plexiglass dividers. And my note to districts or the co-ops, you may want to get your contracts in place, because there was a special on CBS Sunday Morning News that talked about the plexiglass is manufacturers. It's a boom right now for them because of this.
An additional consideration is that those plexiglass dividers would be an additional surface that would have to be cleaned every day by the custodial staff or the classroom teacher.
Or if the kids are old enough, is that something you ask them to do before they leave their workstation? I don't know.
A question about the meals. They said, please address the meals being served in the classrooms next year. Can students go through the service line and take lunch back to the classrooms, one class at a time?
Becky?
Yeah, I defer to Becky on that one.
Yeah, I mean, I think we can double check the recommendations on that, but it was my understanding that, I mean, you know, the ideal situation, it would be a box lunch or something that would be delivered to each classroom. So let me check on that and follow up on that question. I'll write that one down.
Well, and yeah, that's something we certainly need additional feedback on and need a back and forth on. You know, I understand the box lunch, but we've been feeding kids out of boxes and plastic bags all summer long. And while we're grateful for that, there is, you know, the meal patterns are hard to meet with all the food that could be in a box lunch. There's not as many options. So, you know, we need to also balance the USDA food pattern. And so I just want to make sure you all know that needs to be as part of our consideration.
How feasible is it, and I'm sure it's grade specific, but if I went to the cafeteria and got a plate, that I would get back to my classroom to eat it all in one piece, or would it be down the hall? Yeah, I mean, I'm thinking about that too, because we certainly don't want to make suggestions that are just going to cause more issues than we have to. So,
well, if the I know that schools have the of course the reusable plastic washable trays, but in this setting it would be the disposable. You know, just like the restaurants are doing, they're promoting use of more disposable ware.
A lot of that depends on the footprint of course, of the building. There's an elementary school here just a few miles up the road. That would be a great option for them. Be very easy to walk down there. I've been in other schools, particularly high schools and middle schools. It's an absolute hike from one end of the building to the other.
Yes, yes, it is.
So
I think at the middle and high school level, if there's an ability to set up tables or picnic tables 6 feet apart outdoors, that's a great, with those older children, that would be a great social distancing measure.
Question on the plexiglass dividers, would they have to go all the way up to the floor, or could the bottom of the desk be open with the plexiglass on top?
I guess I was thinking front and side. I wasn't thinking top.
No, the ones that I've seen are just in the front and on the sides.
Mm-hmm.
Okay. Another question, this is kind of, I guess they're alluding to the timing issue in terms of if classes are no longer than 50 minutes, can the 6-foot social distancing be waived as well?
I don't understand that question. I'm sorry.
I think it goes.
I understand it. They're talking about in the middle and high school level where they change classes. So no, you can't consider a classroom just like the bus, because then that means that every student, if they're changing classes every hour and they're not social distancing, then that's 6 classrooms of people that they are not social distancing from versus just one school bus.
Yeah, I think that's where they were coming from on that one, although I can't read more into that one. And other than that,
Tony, before we get too far away from the cafeteria discussion, a comment here is if we could reiterate why cafeterias cannot be used. And then the comment went on to say that, you know, in most schools, the cafeteria is the largest room, if not the second largest room. And so it's easier to spread kids out. And I assume your answer is going to be because you're bringing in the multiple students.
And you're
multiple
taking
classes. Okay, if you could explain that, and then if that's the case, is there a possibility of using cafeterias so long as there was a protocol to sanitize in between certain classes?
I think if you can keep people 6 feet apart and sanitize the tabletops between kids, And that would be a way to do that if you've got space, time, and people to do that. Yeah, that's doable. And if you've got families that live together, if you've got siblings that want to eat together and they're living together, they don't have to be 6 feet apart. But it's taking the mask down, you'll need the 6 feet distancing.
Okay,
The other requirement would be, I think, when the overarching goal is the contact tracing, where the student sits in the cafeteria, it almost needs to be assigned seating. Because if you make a middle school and a high school cafeteria sort of a free-for-all, it's very hard to do contact tracing in that sense. Whereas if they're eating in the classroom, you know exactly who's been in the classroom with them. That's the only caveat. I don't know what you think about that, Dr. White.
Yeah, I think if you just know where everybody's sitting, so that way you can, yeah, I think that's doable. I mean, that's extra work, but I think it's not like giving a kidney. I mean, you can figure out where your kids are sitting and just tell them they have to sit the same way every day. Or if they change, then in your records, you change where that sitting happened.
Since we've come to that conclusion here, as I know there still has to be some final sign off, but since we've had that today, is that something you all will go back and add to your document, or do we need to memorialize that at KDE and then layer that in, or how's that going to work?
We can put it in our document, and then Thursday make sure that we captured everything that y'all said today.
Right. We can add that language into it, yes.
I'm writing it down.
Great, thank you.
All right, and then I think this is going to be a question for us at KDE. Are there liability implications for transporting are there not liability implications for transporting students to games via carpool? Our insurance provider would not recommend this as an option.
Yes, there are liability issues, and with that, and there are other statutory and regulatory issues with when the school district actually has to provide the transportation, and so that would limit that. Speaking of liability in general, that's an issue that's also popping up. Tony, you're probably getting it as well. We're going to have that as a topic next week's webcast, liability issues. Of course, the department can't give districts individual legal advice. We can give you an overview of the liability, basically the liability framework. We are reaching out to some of the insurers to see if it is true that, or what they are saying to you. We're hearing they're saying to you very in terms that if you don't do X things, you're not going to be covered under their policy. We were trying to get to the bottom of that. And then in addition to that, we've reached out to Senator McConnell's office because we were hearing there could be a bill passed by Congress that talks about liability, some type of liability protection. We're trying to figure out if that's going to include local school districts. So all of those issues, that's more than what this question was, but just know that that's on our radar, and hope to have Todd Allen and others talk about that next week. We've also asked KSBA to send out the Council of School Board Attorneys the most recent presentation that was given to the Council of School Attorneys to your board council, so they will be well versed on those liability issues to talk about that with your board.
Okay, and then just another question or a comment has come in with the guidance, the possible Healthy at School coming out this week. Will you all be on the webcast next week to potentially answer questions as well?
Before they answer that, we want them to be, but we know they may or may not be able to be. The guidance document will be a subject on the webcast next week. So if for some reason one or more of them cannot join us, we will still talk about it and then give questions and feedback back to them if they can't. But we hope that they can as well, since that's going to be the first meeting after it's released.
Okay. And we'll work with, and we will obviously keep our communication going with superintendents to let you know if that's possible or not. But we should have an agenda established hopefully by Thursday or Friday on next week's webcast. So with that, I mean, we have about 20 minutes left. I'd like to move on to some of these other topics so that we can stay ahead of schedule on our guidance document release. And then if we have some time left, we can go back to, I think DPH said they can stay on until the end, but I know we want to wrap up because with the governor moving his press conference to 4, we do want to wrap up right around 4 o'clock. So I think what's next is the PEBT. And we do have some more questions, but I will go ahead, and I know that they're going to do a very brief overview.
Hi, good afternoon. We have discussed PEBT, the PEBT program on the webcast a couple of times, but we have not talked about it since the approval of the state plan. That was announced on Thursday, May 21st by the governor on his press conference, as well as the Secretary of the Cabinet for Health and Family Services. So just briefly, this is a program being administered by the Cabinet for Health and Family Services in conjunction with and support from KDE. It is a financial resource provided through the USDA for families with students eligible for free or reduced price meals. PEBT provides households an EBT card with funds to spend on food at home for their students. Eligibility for this program includes all students who participate in the National School Lunch Program and who had access to free or reduced lunch when we transition from in-person classes in March. And this also would include any students who have become eligible since March. And it includes all students who have access to free meals in CEP schools. Next slide, please. Most eligible students will receive a total benefit of $313.50. And here, this outlines some additional information about the benefit. I do want to mention that if a student became eligible after March, their benefit may be prorated based upon those the months of their eligibility. Next slide, please. PEBT has been rolled out in 2 different groups. Group 1 includes currently enrolled students who are receiving SNAP benefits on an active EBT card. Those benefits have already automatically been put on their existing EBT card. Group 1 also includes currently enrolled students who are receiving Medicaid or KTAP benefits based on income levels below the NSLP guidelines or who are in foster care. They will automatically receive a PEBT card in the mail, and no further action is necessary for these Group 1 students. And just some information about Group 1, the majority of processing has occurred for Group 1, and the total issuance of benefits is over $112 million to almost 360,000 students. Group 2 is the group that will be the focus of assistance needed from school districts. Group 2 are students who will opt in for these benefits through the CHFS Benefind website. The application opened on June 1st, yesterday, and will be open through June 30th. When applicants go to the Benefind website to request this benefit, they will need their SSID for the students that they are applying for. And again, this application officially opened yesterday, and as of this morning, there have been 41,813 applications submitted that included 63,580 students and almost $20 million in benefits. Next slide, please. Next steps, information has been distributed to districts mainly through their food service directors, but has also been shared with CASES contacts and your DPPs. A webinar was held last Friday, May 29th, and provided full program details in a question and answer session. For those who weren't able to attend the webinar, there is a recording, and the link is here in this PowerPoint. And we also have, that's listed, or the recording is on the KDE Media portal. They're also listed here, you'll see a link to the Benefind site where families will apply for this benefit. Next slide, please. So just to recap responsibilities of the district, we need districts to communicate and promote the benefit to their families, to provide direction to families on how to obtain their SSIDs, and to assist with both of these tasks, a PEBT flyer has been created and provided that includes the majority of the information that's needed, that districts need to share.
The flyer has a box that districts can use to customize with their individual instructions for locating SSIDs, and the PEBT website link is on this slide. It also includes an FAQ document. And finally, we need you to direct your families to CHFS if they have questions. CHFS has set up an email box for questions, and we need you to direct all questions that are not related to SSIDs to this email box. And it's listed here, pebt.info@ky.gov. And again, all of this information has been shared with your food service directors. And just very quickly, this slide outlines nationwide waivers that have been extended. This information has also been shared with your food service directors, but most of the waivers that were in place to assist with feeding were set to expire June 30th, but the majority of these, the ones that are necessary for your summer food service programs, were extended through August 31st. With the exception of the meal pattern waiver, and it has been extended. That one actually does expire June 30th. But if we do receive an extension for that one, we will definitely send that to you all. And that is all I have. I'll, of course, be here with questions. And my Assistant Director, Tim Cooper, who's leading this, also is available for questions.
All right. And then we're going to go right into the guidance document that we released last week on May 26th, which is the considerations for supporting student and staff wellness. And I believe Dr. Sweeney is joining us on that.
Good afternoon.
Yep, unless Dr. Foster was going to say anything before that.
No, we're ready for Dr. Sweeney.
All right, go ahead.
All right. Good afternoon, superintendents. I'm really excited to be with you. I'm going to move super fast just for the sake of time, but hope to convey the importance of this document to you today. So one of the first things that we need to make sure that we do when we reopen is maximize ways to ensure your school is friendly, welcoming, helpful, non-judgmental, and caring. It's been mentioned today already, but promoting the psychological safety of not only our students, but also our staff is going to be paramount when we reopen. We must acknowledge what happened and who is not there. It's going to be really important to know that, many of us will have responded to COVID-19 in a different manner. Some of us will, we'll be able to head back to school just as other people do, and then other people may have moved, may have moved on, et cetera. There may have been different circumstances for them, so we must acknowledge what happened and certainly acknowledge who is not there. We have to rapidly identify students, family, or staff having problems, and then provide those personalized supports for those individuals. We also need to refer students in need of additional supports. By that, I mean that if we have students or staff members who are at risk of hurting themselves or somebody else, we will need to get a community-based agency involved. So questions to consider for this: how will everyone be welcomed, oriented, and positively connected to the school? What outreach will be made to the students and families who are expected but did not return? How will staff minimize problems during daily transition times? I think many of you, I've spoken to you several times, you know that I came from Seneca High School and JCPS, and we adopted PBIS, and we would always say, walk and talk, walk and talk. So how are you going to minimize those transition distractions during those transition times? How will you provide supports for those that are not adjusting well? We certainly don't want to punish or re-traumatize those individuals. How can we incorporate SEL activities in every classroom at the beginning, middle, or end of every lesson? This is also going to be extremely important for all of our content teachers to adopt and accept that they are now, this is absolutely necessary to include social and emotional learning in everything that we do. What structures, activities, and program will we have in place to facilitate a culture where everyone feels safe, valued, and cared for? And then what resources and partners are available to assist students during this time, students and staff during this time? Reopen schools with a sense of excitement and hope and resilience. Consider a kickoff renewal planning group committee to publicize what makes the coming year so special, and then also plan kickoff events, make sure that they comply with health guidelines, of course. But these events that welcome, your teachers, your staffs, your school community. Dr. Polio did a great job of this one summer. He had a kickoff event and he showed this amazing clip from ESPN that I'm going to put in the chat. Well, we'll make sure we send out a link for you. But it was this E60 news story, and it talked about a hockey player that was tragically injured, and it talked about how a doctor said, we're not going to give up on him. I'm really, really good at my job. And that's really the approach that we have to have when we come out, when we come back to school, and that we have to encourage other people to have as we return. Next slide. Okay, so questions to consider. How can our leadership team embrace and communicate to staff that we can get through this and that we have an opportunity to create a new perception of our school? This really is an opportunity to do just that, which is really exciting. How can our leadership team show all staff their voice matters? How can we celebrate the return of staff and students? And then what new traditions can we start? Okay. We also need to make sure that we address grief, loss, and traumatic stress. When we normally think about grief and loss, we think about death. But for many people, they've lost a lot of things that were really near and dear to them. For your athlete, it could have been that season that they were really looking forward to. We know that people have been grieving the loss of proms or high school graduations, et cetera. So we need to help others dealing with loss by acknowledging, again, what's happened, allow others to express their reactions, and validate the emotions that emerge at each grief stage. We also need to prepare students and staff for what to say to someone who is grieving and how to act appropriately. You might think that just comes as second nature, but we really do need to coach our staff as to how to facilitate open dialogue and ensure that we create norms to make sure it's respectful. Help students who are grieving and reluctant to return to school. If you can go forward one slide. So we should prepare for outreach, right? As you know, I'm the program coordinator for comprehensive school counseling, so I'm a resource for counselors. We are strongly suggesting to our counselors that they continue to check in with students and families over the summer. We should also create and implement special support and accommodations at school, right? So if we do have individuals who are struggling with this, we should prepare for an abundance of counseling needs in and out of school. And then we should explain potential signs of stress in students and staff and find ways to create a space where people feel safe, respected, and cared for. In a previous superintendent webcast, Miriam Selman and I spoke about those signs of stress. So you can use the PowerPoint that we provided previously for that. Here are different questions to consider. What do we have in place to support students and staff who appear to be deeply sad, withdrawn, or in distress? What community resources do we have? Are our counselors situated to handle many individual counseling sessions with students in need? At the beginning of the year, it is not uncommon for counselors to be sitting off to the side and working on schedule, so we might need to repurpose them to address some of these issues. What do we have in place to support Tier 3 students? So again, those students who think they may be at risk of harming themselves or someone else. Have we made time for our counselors to address the mental health of their students through Tier 1 instruction, so that whole group instruction, and Tier 2 direct student services, so those individual or small group counseling? Have we been clear on the protocol for teachers to let counselors know when a student is in distress? That's so important. Many of you can relate. We often, as counselors, will get a call at 2:18 p.m. when school ends at 2:20 that says, I've been thinking about this student who said something in first period, and it's really concerning. So we need our teachers to know that if an issue does come up, we need to be notified immediately. And then what other support staff do we have in place to help students who need extra support? And this is really important as well. What buddy or peer support system can be set up to support connection among students and staff? Okay, next slide. Okay, we need to re-engage disconnected students in instructional activities, so understand their mindset. We provide on the guidance document this brief video about the learning brain versus the survival brain, right? The learning brain is going to be very calm and be able to accept new knowledge and access new knowledge, while the survival brain is really looking for that flight, loss, flight, or freeze moment. Providing student choice and voice is important. Don't make tasks high stakes, and then plan for student engagement by ensuring the instructional approach honors student needs, circumstances, and interests while being relevant and valuable to their lives. So everything should have relevance for that student. We also want to incorporate brain and body breaks into daily lessons. Okay, next slide. All right, so we'll finish up with this. What am I doing to create a physically and psychologically safe classroom to support students in both learning brain and survival brain? Are we engaging our students in a manner that honors their voices and choices? How do we create tasks that do not convey high stakes or pressure? Are our lessons relevant and engaging? Am I taking care of myself so I can engage with students in a calm, warm, and caring manner? And then how are we going to communicate to students the various help and supports they can reach out to if schools are closed again? Last slide. So we finish up with re-explaining the trauma lens and how we should really approach school and the reopening of school through that trauma lens. We also give you a great graphic on helping students and staff members build resilience. And finally, we finish up with crisis hotline information that you can provide to your school community. Thank you so much.
Okay. So with that, I will go back to the soapbox. There are a couple of questions on here that I think we have about 5 minutes left, that we can go ahead and I can take care of real quickly. There was a couple of questions in regards to guidance that is issued by the department in terms of issuing them on Fridays. And one of the concerns was the last week's PEBT or the document that we sent out on Friday. And I know that a couple of districts are, they get a little frustrated with things that are sent out on Fridays, and we are trying to avoid sending out documents. But the thing that was sent out Friday on PEBT was actually coverage of the webinar that all the superintendents were invited to participate in on Friday morning. We actually initially did a joint press release with the Cabinet for Family Services. I believe it was on the 21st or the 22nd, and previously published the FAQs on PEBT a week prior. So none of that information that you received on Friday should have been new to you. It was just a webcast for questions prior to the information on PEBT going up live, which went up on June 1st. So again, we are cognizant of releasing documents on a Friday. Trust me, being a former reporter, I try to remember that myself. I remember what it was like being, in a newsroom at 4:30 when things get dumped on reporters in newsrooms, and I try to be cognizant of that. However, we can't control when things come into the department, and we do want to be very quick and efficient in getting that information out to our superintendents and to our employees as quickly as we get the information. And that is our goal, and that is our promise to you as superintendents. Kevin, if you want to elaborate on that, there was just a couple of questions about that.
No, I think you explained that well. That's never our intention to put you in a bind. We heard from you loud and clear about the work of the task force. We're now sending you those materials before the information about the task force every week goes public. We'll do the same regarding the Superintendent's Advisory Council that will start meeting opposite of the task force. So every Monday we will have either, as I said, the task force of all the groups, and then the following week we'll have the Superintendent Advisory, and we'll keep rotating these topics through them as we move forward. The members of the Superintendent's Advisory Council, if you don't know, it's on the KDE website under the Commissioner's Office. And for the members, I apologize because your colleagues may be looking you up and bending your ear, but that's what we want. So we know even if you don't get any calls, we know that we have great membership on that advisory council, and we'll have great feedback for these issues. And obviously what they will be looking at Monday at the Superintendent Advisory Council, which is the first time we've had them back during the pandemic, or I think it was right before the pandemic, or maybe it was that first week, will be the information coming from public health, that final document, hopefully. So if not, we'll still be talking about those issues, even if we don't have the final document at hand.
Correct. And I will do, just like I do with the education task force, I will send them via email before I send out an advisory to the media or to anybody else. You will get that via email. I usually give it about a 2-hour time frame. So I know that you all are probably not diving into your emails between the hours of like 5 and 7 p.m. on Mondays, but that is the time period that if you want to review, what happened and look at the video from the Education Continuation Task Force and now the Superintendent's Advisory Council, that is the time to check your emails on Mondays, because that's when they will be coming from me. And so I can promise you that I have been sending those out every week, and that will continue. And we'll, if we can improve that process, I promise that we will look at ways to do that. There's a question here about how somebody can get on the Superintendent's Advisory Council.
The information on how that's, and that this is the commissioner, student, or I'm sorry, did you say student or superintendents?
I may have said student because that's on my brain as well, but it's
okay.
The superintendent one.
Okay. The Superintendent's Advisory Council is different from the local Superintendent's Advisory Council. Both committees are made up of superintendents. LSAC is statutorily required. We bring them, LSAC, in to advise us on mainly the regulations that go before the State Board of Education. The Superintendent's Advisory Council does not necessarily look at regulations, but they look at other policy issues and a sounding board for the commissioner and KDE staff, just like the Teachers Advisory Council, the Principals Advisory Council, the Parents Advisory Council, and on and on. But we are bringing back the Superintendent's Advisory Council every other week until further notice, because we value that feedback. We need it, but also because you brought it to our attention. That was a concern of yours, that you did not think we had enough direct contact with superintendents about some of this guidance. So that's why we're pivoting in that way. I didn't answer the question. How do you get on it? That's on the website, but I believe the members are chosen by each of the co-ops. I believe that's what I just read.
Okay, question for Lauren. Are all students in a CEP district eligible for the PEBT benefits?
Yes, they are.
So even if they do not even if they're not subject, or they're not qualifying for free and reduced price lunch on their own, if they're in a community eligible school, they also qualify for that money?
Yes, if they had access to free meals through a CEP school, they are eligible for PEBT.
Okay. And then I think this is a question that was asked last week, and I'm not sure if we have an answer to that yet, but will the duty-free lunch be waived for teachers? Has the department had a chance to respond to that?
We haven't had a chance. It's on our list to evaluate based upon the final DPH guidance as to what that's going to do to the lunch period. And then we're going to need to work that through the various advisory committees, including the teachers or the power today, the advisory committees, the Superintendent's Advisory Committee, as well as the Continuation Task Force. And of course, talk to other groups, teachers groups, et cetera. But obviously that is something that could be the subject of a temporary waiver for the next semester or other alternative hybrid solution. We realize that could be a problem.
Okay. I'm just jumping up to the top of the list. I know we're right at 4 o'clock. I'm not sure if he started or not, but just a quick question about, do we know anything about K-Prep for the 2021 school year?
Know that it's starting to be discussed as far as testing requirements from the federal level. We're starting to hear discussions at the national level about whether or not there's appetite at the U.S. Department of Education for some type of waiver. My position of that decision will probably come under the new commissioner. It's been our position up to date that we want to take advantage of all federal waivers. Of course, our state required testing runs parallel with our federally required testing to have one unified system. So it's being discussed. I've not heard anything yet, though, from our national organizations that is anywhere close to being a decision by USAID that they would entertain that right now being a waiver, but I think it's being discussed.
Okay. Just one question, and I think I can answer this quickly, is can we have one document on KDE website that all guidance gets added to under categories so we can keep up with what is current and recommended? There's too many documents coming at us. So we have on the KDE homepage or on the KDE COVID-19 page created a green under Educate, Feed, Support. There is now a green, I believe it is green, or it was green the last time I looked at it, for guidance documents under reopening, I believe it's called. And so that is where we are trying to put all of the guidance documents. And you are correct, there are a lot of documents coming out, and that is for your benefit. And we're doing this for our districts and for our superintendents. We are releasing, I believe it is, and Kelly, if you're still on, 2 documents or 2 guidance documents a week every Monday. So
yes, Tony, and keep in mind that the reason that we're doing the individual documents by topic is so then the people on your district reopening team can use those based on what their areas of expertise are. So you can give the transportation document to Director of Transportation. You can give the food service document to the folks that are over food service. So they are separated like that so that the people that are doing that work will be able to use those efficiently. And of course, as those are posted each Monday, the date of the posting is right beside the document, so you can see how they are posted based on when they are released.
And then, we are also, again, and those are also being sent to you all before they are being posted publicly. I know that there's a lot of superintendents. There's questions on here about why are the superintendents not being given more time to review things before they go to the public. We are doing our very best. I know in my office, I'm constantly thinking about, we need to get these documents out for review first. I know that at the commissioner's office level, same thing. It's just that, it's an evolving, there's a lot of documents coming at us as well. So we're just trying to do our very best, and we will try to do better at getting these things to you. It's just that a lot of times it happens after office hours. And so a lot of times the time that you may be asked to review things may be after the hours of 4 o'clock or 5 o'clock on a weekday or a work day. And it may happen to fall on a Friday. I will do my very best to make sure that doesn't happen, but there's going to be times where it does, just by the nature of the business, and because we have a lot of guidance documents that we will be providing to you over the next several weeks as we prepare for the reopening of our schools this fall. And I think the rest of these are going to be related to just asking. They're wanting Commissioner Tackett to provide some Q&A just in written form so that they can look at it. And I think that we typically do that with these Q&As so we can get that to them. And there's a couple of other things on here, but we can carry these over to next week just so we can wrap up at 4:08, unless you have some following, some closing comments.
I think we should, because the governor wasn't able to really address COVID-19 yesterday due to the other events, we probably need to watch that just in case. There'll probably be a lot of information on today's press conference. Next week's webcast, we already know we're going to have a discussion of the liability issue, an update on potential congressional relief on that, Department of Public Health guidance and additional discussion, open invitation for them to join us again if possible. And then obviously there will be another guidance document, I believe, in the hopper for release. And I'm sure there will be other issues that come up before then. So I want to thank everyone for your attention and for participation. I feel like the fuzziness of what next year looks like starting to come into a little bit better focus. I want you to reassure you that I've been very impressed and with our interactions with both the governor's office as well as public health on their desire to get this right. They are trying to balance data that's coming in and affecting the curve and the plateau and what that means for the future and predictions with guidance that's right for the time. And I know that's frustrating on your end and on our end too, because right now you want clarity. You want to be able to know how you're going to open your district. You want to know how it's going to look. But we're trying to get that balance of being able to lessen some of these restrictions based on the data. And that's taking a little time to do. And so a great example is, the public health really heard the issue with school buses, and they were able to come back with some other recommendations and solutions on that. So this is going to be a continual dialogue. As they said, the guidance they've already issued for healthy at work and healthy at home, that's changed over the course of time because of what the virus is doing. That's going to be the same here. So everybody hang in there. Thank you for what you're doing, and we will see you online, if not this week, next week. Thank you.